telephone can be more difficult than speaking in person because many of the non-verbal cues are missing. When dealing with client or patient who have a hard hearing, it is particularly important to create a good first impressions of your conversation. This first impression is created almost solely by your voice. To communicate effectively on the telephone, use a pleasant tone of voice when answering telephone calls. Avoid sounding harried, angry, or distracted, especially when you talk to an old man. If there is an uncomfortable pause on the other end of the phone, ask for clarification. Is there anything else I can help you with?
When you're talking to someone, especially an old client with hearing problems, using a good phone technique will help them hear as much as possible. Make sure you speak directly into the phone's mouthpiece, but don't hold it too close. And remove as much background noise as you can. Make sure they know who they are speaking to and what the conversation is about. Speak clearly as you can and be prepared to be patient and to repeat what you have said.
Reduce background noise. Eliminate as much background noise as possible, including music, television sound, and other people's conversation. Find a quiet and peaceful place where you can make and take calls with no interruptions at all. In this way, you won't hear all the hustle and bustle going on around you, and you can make sure that the quality of calls you provide is on point.
Be understanding. Always practice patience and explaining something to an old patient who can barely hear. If you get frustrated, take a deep breath and consider how hard the situation must be for them. As much as you want that person to understand what you are trying to convey, know that they also want to listen and understand too. Misunderstandings are bound to happen, so try to keep things light and continue the interaction.
Pick one at a time. Conversation with multiple can be difficult or with the hearing loss to follow. In group settings, try to make sure only one person talks at a time. Side conversation and talking over one another can make it confusing and overwhelming for a senior with hearing loss to persist.
Speak with clarity and right voice volume. Face the person and enunciate while speaking, but don't exaggerate your speech. The same applies to your tone and voice volume. Some seniors with age-related hearing loss benefit from a speaker using a slightly raised voice. But don't short. Be mindful to speak at a reasonable speed as well. Not too fast but not too slow.
Morning. Is this Big Burn Clinic?
Good morning. This is Big Burn Clinic and this is Brand speaking. How may I help you?
Is the doctor present? I would like to make an appointment.
Yes, the doctor is here right now, but unfortunately, the doctor is with the patient right now and can't be disturbed. May I ask who is calling?
Hi, I'm Christian. I was 69 years old. I've never been to your office before.
I think it's not easy for your age to fill out form. Would you let me do it?
Yes, of course. Thank you very much.
Can I ask your name, age, address, and the last time you got a checkup from a doctor?
Come again? I can clearly hear what you have just said. What is it?
Can I ask your name, age, address, and the last time you got a checkup from a doctor?
Oh, sorry. Well, I'm Christian Senya. I'm 69 years old and I live in Elm Street, Ohio. And I think I just can't fully remember when I had the chance to see the doctor. Sorry.
If you want to go to our clinic, I suggest that you can bring someone that will help you. Since at your age, it's not easy for you to go alone. Would you prefer tomorrow or the other day?
Didn't you say tomorrow? Well, then yes. I'll drop by.
Good. We're open at 8 a.m. I also suggest that you may come early. It's better to your condition. We would love to assist you.
So thank you. Have a good day. I'll see you tomorrow.
Thank you for your cooperation, Mr. Christian. Goodbye.